Welcome everyone to the demo session. I am Dr. Sourabh. For those who don't know me, I take ophthalmology in DAMS. So today we are going to discuss in about 45 minutes about retinal angiography. So as I've told you that this is a slightly difficult topic which I've chosen. And see, I'll start from the scratch. I'll start from the very basics, and then I will try to go to a very high level as well. But let us see from the beginning what is this retinal angiography is all about. Okay. So what is the meaning? It split the word retina. Retina is a part of your eyeball, the posterior part of the eyeball, and angio means blood vessels, graphy means study. So we have to know about some point regarding retina. Then only you should know about this. Then some part regarding the blood vessels of the retina, the blood supply of the retina, and then we will study what is it. Okay. So let us now start our session. Okay. All right. Okay. So let me just introduce. Let me take you inside the eyeball. This is your iris. I'm just dilating the pupil, and I will take you inside the eyeball where actually the retina is. Retina is in the posterior part of the eye. See, we are dilating the pupil. To see the retina, we have to dilate the pupil. See, we are going inside, and this is our retina. Okay. What is the extent of the retina? This part is what? Optic disc. And retina goes from the optic disc margins towards a structure known as ora serrata. Okay. So what is the extent of the retina? It is from the optic disc margin. This is your optic disc. So from the optic disc margin till a point known as ora serrata. See, ora serrata is in the peripheral of the retina, and it's the junction of ciliary body and choroid, or retina and ciliary body. You can say like that. So from optic disc margin to ora serrata, we have the extent of the retina. That is one point you have to know. Now come on, let us see this picture you are scared of. This is the retina picture. Few points you have to know about this. Okay? So those who want to write down, they can write down as well. So let us draw a circle like this. Let us draw a circle like this. This is our retina. This is what this point I'm making. This is your optic disc. You saw in the video also, no? This is optic disc. What is the size of optic disc? The size of optic disc is 1 disc diameter. 1 disc diameter is the size of the optic disc, and normally we take it as 1.5 millimeter. That is 1 disc diameter size of optic disc. Okay. Okay. Now you can draw these vessels of the retina. It can be arteries. They can be veins. You can see over here. See, this is the optic disc which we have drawn in our figure. Out of this A and out of this B, one is an artery and one is a vein. I think it's okay. It's not hang. Check your internet connection bhi. Jio se bahar niklo. So one is A and one is B. One is artery and one is vein. Which one do you think is the artery and which one is a vein? Okay. So for this you want to know that the artery to venous ratio in the retina is 2:3. What does it mean? That the lumen of the artery, this is artery, the lumen of the artery is smaller than the lumen of the vein. Artery lumen is 2:3. That is the lumen of the vein. So which is vein here? This A is a vein because it is looking thicker, and this B is a retinal artery because the lumen is smaller. So this is what we want to know. 2:3 AB ratio. Okay. One step more further. Now let us go from the optic disc margins. 2 disc diameter. 2 disc diameter means how many millimeters? Maths हमारी अच्छी है बच्चों. Maths हमारी अच्छी है. 3 millimeters. So 2 disc diameter temporal. This is a temporal retina. So this is the nasal retina. There is a small point. This small point is known as foveola. Okay, so 2 disc diameter is temporal. There is a small point known as foveola. surrounding the fovea, there is a imaginary space. The imaginary space is known as fovea. This imaginary space is fovea. And surrounding the fovea, there is also a imaginary space. This is known as macula. So fovea, then fovea, then macula. And what is the important point? All of these three are in the temporal part of retina. So where is optic disc? In the nasal part of the retina. This one is okay till now? Good, Prajesh. Alright. And the center point and the centermost point of the retina, centermost point of fovea is known as umbo. So I'm just telling you some anatomical points which you want to know. Okay? So all these fovea, macula are in the temporal part of the retina. So by knowing this, can you tell me this retina which I have drawn, which you have drawn, or which is this picture, this is right retina or the left retina? This is right patient's or the left patient's retina? So this is an important point. Whenever retina fundus picture, retina is also fundus. Fundus picture is shown to you. You have to imagine that this is the patient's retina. This is the patient's retina. This is doctor's view. Doctor is seeing. So for example, I am standing in front of you. Okay, I am patient and you are all doctors, or you will be doctors. This is my right eye, this is my left eye. Where is my temporal of my right eye? On the right side. Where is the temporal of my left eye? On the left side. So where will be the fovea of my right eye? Right side. Where is the fovea of my left eye? Left side. So just in the picture, without applying any brain, just see where is the fovea is. Patient is standing face to face. Just see where the fovea is. Fovea is on the right side. It should be the right retina. So these both are right retina of the patient. If अगर ऐसा हो जाए तो दो ही आंखें हमारी, तो अगर ऐसी पिक्चर आ जाए तो रेटिना की fovea is on the left side, so this becomes the left retina. So very easy to tell. Fovea on the right side, right retina. Fovea on the left, left retina. So this is some anatomical points of the retina. Now let us go one step further. Okay, let us go one step further. Okay, what is the color of retina, by the way? Can anyone answer what is the color of retina? So यहाँ पे it's looking red, some say orange, yeah, some say pink. Okay, yeah, very good. So retina is colorless. Okay, no red, orange, pink. It appears to be red or orange or whatever because of the choroid vessels behind, which reflects the light. So retina is a transparent tissue. Alright, but if you can see carefully in this picture, if I just show you this picture, can you appreciate the fovea and fovea a little bit darker as compared to the rest of the retina? What is the reason of this? Why is the fovea a little bit dark as compared to the rest of the retina? Very important point. Because the fovea has high pigments concentration there. What are the pigments? It can be xanthophyll, it can be melanin. So more pigmentation at the central retina, fovea, that way it appears dark in the fundus picture. Okay, good. Sumit, तुम multiple message कर रहा है. Sumit, तुम एक ही हो, तुम एक ही message करो. Okay, now let us go one step further. Okay? Now, if we go from the vitreous towards the retina and then towards the choroid, we want to know what are the layers of the retina. From the vitreous, see, this is retina. This is retina. R is retina. From vitreous, the first layer of the retina comes internal limiting membrane. Okay? I'm just saying this because this will help you in angiography, to understand angiography. This layer is not important. Then comes the layer of nerve fiber layer. See, nerve fiber layer will ultimately combine to form the optic nerve. And this nerve fiber layer is nothing but the axons of ganglionic cell. Then there is a plexiform layer. Plexiform means synapse. Why? Because the synapse from the inner nuclear, see, inner nuclear contains various cells. I'm not going to detail anything because the topic is angiography, not going to histology. Can be Muller cells, bipolar cells, horizontal cells, amacrine cells in this inner nuclear layer. Here the impulse goes from the synapse into the ganglionic cell. then it goes into the axon and then into the optic nerve. Okay, that's in visual pathway. So plexiform means synapse. So there is another plexiform, outer synapse, because the nucleus of rods and cones lies in the outer nuclear layer. So here the impulse goes via synapse into the inner nuclear, then into the ganglionic, then into the into the nerve fiber, into the optic nerve. Then there is the outer limiting. If there is inner limiting, there has to be outer limiting. Saurabh, देखो आपका नाम इतना अच्छा है और क्वेश्चन भी इतना अच्छा है. RPE has pigments. The pigments which I mentioned, melanin, xanthophyll, they are in the RPE. So they are pigmented. Okay. So usually what you talk is neurosensory retina and retinal pigment epithelium. Neurosensory retina is a transparent tissue. RPE has pigment, so it has brownish. You can see over here, na? RP, it has some pigments. So pigments were there in RP only, which is more concentrated in the fovea. Then comes the main rods and cones layer. Outer nuclear contains a nucleus of rods and cones. And then the pigments were there in the RP layer. That's how the name is pigment epithelium. Saurabh. Alright. And then comes choroid vessels, and then comes the sclera. So vitreous, retina, choroid, sclera. This is the orientation. So how many layers hoge retina mein? 10. There are 10 layers in the retina. All over the retina there are 10 layers. All over the retina there are 10 layers. But what was the central point of the retina? Fovea, sir. So fovea contains rods or cones or both? So fovea contains only cones. And what are the nucleus of cones? So outer nuclear. So internal limiting and external limiting should be present everywhere. And RP is of course present everywhere. So fovea contains only 5 layers. ILM, outer limiting, cones, the nucleus of cones, and retinal pigment epithelium. Sir, what about what after fovea? There was another space known as fovea. So fovea contains one extra layer. The outer plexiform layer is one extra layer in fovea. And this outer plexiform layer is also known as Henle's layer. It was discovered by Henle's scientist. Sumit, dekho, Sumit is asking me question, important question, order of neurons. Okay, so there are 5 layers in the fovea, 6 layers in the fovea, and rest of the retina contains 10 layers. Okay, these are the layers of the retina. You should know about this also. That is why if we do a optical coherence tomography, this demo is not for OCT, but I have to explain you to understand angiography. OCT tells about the central retina. If you scan the central retina, it tells about the retina layers. In this, if you can appreciate now, this is vitreous. These are the 10 layers of the retina. The last red line is the RP, last layer of the retina. Then choroid, then sclera. So here in the macula, all the 10 layers of the retina are there. Why there is a dip? Because fovea contains 5, fovea contains 6, and the rest of the retina contains 10. That is why there is a dip, curvature like this in the central retina, because of the less number of layers in fovea and fovea. And see, outer plexiform is present in fovea and rest of the retina. So the orientation of outer plexiform is radial. It goes radial, discovered by Henle's scientist, also known as Henle's layer. Remember this point. It will help you in solving many questions. Alright. Okay. So I have told you about the basic structure of the retina. I have told you the basic layers of the retina and how it is represented in optical coherence tomography. Now to understand angiography now, we have talked about some point retina. In angiography, we should talk about the blood supply of the retina and choroid. Very important, because everything in angiography is based on the blood supply and the barriers of the retina. See this video. Don't need to write anything. If you're writing, I will make you write if you want to write. Just see the video and try to understand. See, the major blood supply which is giving is internal carotid artery, whose branch is ophthalmic artery. Ophthalmic artery gives many branches. Anterior ciliary artery, posterior ciliary artery. Posterior ciliary can be short posterior ciliary. Short posterior ciliary, mostly they supply around the optic disc. If there is short, there has to be long as well. See these two green. There are only two long posterior ciliary artery which is long, it goes ahead into the anterior part of the eye. And then it anastomoses with, if there is posterior ciliary, there has to be anterior ciliary as well. All these are branches of ophthalmic artery. Don't just see, I'll just make you write if you want. So there is anterior ciliary artery which anastomoses with long posterior ciliary artery. Then, very important, central retinal artery. See, central retinal artery enters the optic nerve. It enters the optic nerve and it enters the optic disc, and all the vessels which you are seeing in the retina, all are branches of central retinal artery and central retinal vein. Which you see in the retina, I showed the first picture, 2:3. That was all the branches of, you can see here, central retinal artery, central retinal vein. It enters from the optic disc. This is your blood supply of the retina. Now, if you want to write down, you can write down like this. Someone who want to write down, when making quick notes, you can write down like this. That the major artery is internal carotid artery, whose branch, ophthalmic artery, whose branch, ciliary artery, can be anterior ciliary. There are 7 anterior ciliary artery. Posterior can be long posterior, short posterior. Short posterior are 15 to 20. Long are only 2. And I told you in the video, anterior anastomose with long posterior ciliary artery. They form what is known as arterial circle of the eye. They form arterial circle of the eye. C.H. Anusha. Outer plexiform is also known as Henle's layer. It has a radial configuration from the central part of the retina. It goes radially. It was discovered by Henle's scientist. Now, ophthalmic artery is a very important branch, is central retinal artery, which enters the optic disc. It has 2 branches, very important. Now, be careful, very, very careful now. We are entering into angiography. This is very important. It has 2 branches, superficial branch and deep branch. The central retinal artery supplies the inner 6 layer of the retina. Inner 6 layer of the retina are supplied by the central retinal artery, in which the superficial branch is present in the nerve fiber layer, the second layer, while the deep branch is present in the outer plexiform layer. So only the 6 layers, top 6 layers of retina are supplied by the central retinal artery. Sir, what will happen, sir, of the outer 4 layers? No, the outer 4 layers, they do not have any blood supply. Then, sir, what? They get nutrition from the choroid, ciliary artery. Ciliary arteries are for choroid. They get nutrition from the choroid. Alright, so inner 6 layers, the inner 6 layers are supplied by central retinal artery. Outer 4 layers are getting nutrition from the ciliary, choroidal vessels. Superficial branch is present in nerve fiber layer. Deep branch is present in outer plexiform layer. This is your arterial supply of the retina and choroid. Very important. But now, can you appreciate the vessels in the retina? The central retinal artery vessels are present inside the retina, inside the layer of the retina. What will happen if the blood leaks into the retina? What happens when the blood can leak from the choroid? No, it doesn't leak. Why? Because there are barriers. Very, very important point. Blood retinal barriers. 2 types. Inner and outer. The inner barrier is made up of tight junctions. Always a barrier is made up of tight junctions of retinal vascular endothelium. The central retinal vessels, which are intraretinal, they have tight junctions. They do not allow the blood to go into the retina. That is the inner blood retinal barrier. And what will prevent the choroid blood to go into the retina? Outer barrier. The RP is a very strong layer. Usually it's a complex, but at your level you can understand it's a RP level. RP layer is a very complex, and it does not allow the choroid blood to come into the retina. So there are 2 barriers, very, very important, which prevents the blood from the blood vessel to go into the retina. So this, I've talked about retina till now, the basic structure of the retina, the basic layers of the retina, what is fovea, then the arterial supply and the blood retinal barriers. Very, very important. And barriers are always made up of tight junctions. Okay, barriers are always made up of tight junctions. Remember this point. Now come to this angiography. So this black and white thing, this is angiography. Which eye is this? Can you tell me? Right eye or left eye? See the fovea. Where is fovea? Fovea is present on the right side or the left side? So right side. So this is right retinal angiography. Sir, why is it black and white? Why not colorful like retina? Because we put a, what is this white? White is nothing but a dye, which is put inside the retinal vessels and choroidal vessels. So this is right angiography. We have to put a dye so that it reaches the retinal vessels or choroidal vessels. The first question is, which dye to be used? Okay, we have to understand question wise. Which dye to be used? Two dyes can be used. Answer is two dyes can be used. Okay, before that, Yukti Bansal, the inner barrier. Inner barrier is made up of the blood vessels endothelium. The endothelium is very strong, that does not allow the vessel blood to go from the blood into the retina. And the inner barrier is applicable for the inner 6 layers, central lateral artery. But the outer barrier is applicable for the choroidal circulation. The central lateral artery vessels are intraretinal. The barrier does not allow, the inner barrier does not allow the blood to go into the retina. Outer barrier applicable for choroidal vessels, does not allow the choroid blood to go into the retina. Simple. Now the question was which dye? So two dyes are used. Which two dyes? Fluorescein and indocyanine green. तभी तो नाम पड़ता है, that's what the name is. Fluorescein angiography, indocyanine green angiography. So two dyes are used for angiography, fluorescein dye, indocyanine dye. So that is the first question, which dyes are used? Why? Second question is why? Why only these two dyes are used? Very good development, right? But Sumit, तुम एक बार ही reply करो यार. Because I missed the other option, other messages. There are many dyes. Why only these two dyes are used? Because these two dyes have a property of what is known as fluorescence, a very important property on which the angiography is based. What is this fluorescence property? That if there is an object in which a low wavelength light is coming inside and it has the capability to emit a higher wavelength. Low wavelength is coming inside, but the outgoing is higher wavelength. That object possesses a fluorescence capability. Fluorescein has, indocyanine green has, other dyes like trypan blue dye used in cataract surgery, that doesn't have. So that is why fluorescein and indocyanine are used. Now the question can they ask from here? Which light is coming inside fluorescein angiography? Which light is coming inside and going out in ICG? तो you remember? ये विबग्योर याद है? विबग्योर करके होता था. मैथ्स अच्छी है, फिजिक्स भी तो अच्छी है, तभी तो लिया 11th-12th में, बायो एंड MBBS में आए. तो what is विबग्योर? Increasing wavelength or decreasing wavelength? Increasing wavelength. So see this, in fluorescein angiography, blue has a low wavelength. Blue light comes inside and green light goes outside. That is applicable for fluorescein angiography. That's a question. Blue light comes inside, green light goes outside. ICG, 81 nanometers light come inside, 840 light goes out. It is working in infrared. Okay. Neil, I'll come to that. Okay. So 2 questions I've answered. Which dyes are used? Fluorescein and indocyanine. Why these 2 dyes are used? Because they have the property of fluorescence. Low wavelength comes inside, high wavelength goes outside. Fluorescein, blue light comes inside, green goes outside. ICG 810 come inside, 840 goes outside, and then we click photographs. The emitting light which is coming, we click photographs, and the photographs is what you see as black and white. Now, one more point you can write down. This visible wavelength is used now. Vibgyor is a visible wavelength. That is what I have told you. And infrared is used in ICG. वो तो मैंने बताया. I told you already. One more point you can write down. This fluorescein is 80% protein bound. ICG is 98% bound to proteins. Fluorescein 80% protein bound. So what will happen if you put fluorescein? It is bound to the proteins. Retina vessels, it is inside the retina vessels and the choroidal vessels. But fluorescein, if you see, it is less bound as compared to the ICG. So if you want to see choroid circulation, the choroidal circulation which is for outer barrier was there. If it is 98% bound to protein, the ICG will not leave the choroidal circulation at all. So it becomes better for choroidal circulation, while fluorescein becomes better for retina circulation. Because of high protein boundage, the ICG is not able to come out of the outer barrier at all. Fluorescein can, some microparticles can come out of the outer barrier, but still RP, it cannot come out of the RP. So for retina circulation, fluorescein is better. For choroidal circulation, ICG is better. That is what you can remember at your level. Because it is more bound to protein than fluorescein. Okay? So remember these points. These dyes are used. Why these 2 dyes are used? And one theoretical point. Now you see, हमने देखा है which dyes and why these 2 dyes are used. How will we use these dyes? कैसे पहुंचाएंगे? The dye is in our hands. How will we make this dye reach the retina choroidal circulation? कहीं तो we will put injection ना. Where will we put injection? Will we put injection in ICA, ophthalmic artery, central retinal artery, ciliary artery? या ICA कहाँ से आ रहा है? Common carotid. वो कहाँ से आ रहा है? Heart में डाल दो, काम खत्म करो. ऐसा नहीं ना. तो where will we put? We put in forearm. Antecubital vein in forearm. Injection of the dyes is put in forearm. Then it goes from vein, it goes into heart. Heart, it goes into the arterial circulation, and then it comes into the retina circulation and choroidal circulation. This is how the dye reaches from the arm to the retina in 11 seconds. Arm retinal time, arm to heart, heart to retina in 11 seconds. Question is, arm retinal time is 11 seconds. Okay, now you see this right angiography. White means there is dye. White means there is dye, and white means there is hyperfluorescence. And dark areas, dark means hypofluorescence. So ये 2 word आपको ध्यान रखना है. Hyper means more dye, white, and hypo means less dye. Of course, when you put a dye in the vessels have the dye. That's why they are white. You can see the vessels have white, they have dye. Now tell me the question, why is this dye from the retina vessels not coming out of the vessels? Why it is not coming out? Because of the inner retinal barrier. And can you appreciate all behind the retina there is choroid, there is diffuse choroidal dye there. Why the choroid dye is not coming into the retina? Because of outer retinal barrier. That is what is angiography all about. That the dye should remain in the retina and choroidal vessels. It should not come out in a normal angiography. So vessels are, retina choroidal vessels are hyper or hypofluorescence. They are hyperfluorescence. Now can you appreciate this area? This area is fovea. It is hypofluorescence. It is dark. Why is fovea dark? Can someone think and tell why is fovea dark on angiography? One very basic. How many layers were there in fovea and fovea? Sir, not 10, sir. 5 and 6. So it does not have central retinal artery circulation. Fovea does not have central retinal artery circulation. That is why it is known as foveal avascular zone. The central retinal artery vessels does not reaches because there are less layers. That is one reason. Sir, but fovea is very important, sir. How is fovea getting nutrition? From choroid, of course, from the choroid. Sir, but choroid, everywhere we can see dye. Why can't we see dye behind the fovea? Very good question. Yes, there is dye behind the fovea also. There is choroid, there is dye. But we can't see. Why? Why? Because I told you na, very highly pigmented melanin xanthophylls are present at the foveola. That is why the choroid dye is not visible. Of course, there is choroid dye behind the fovea also, but we can't see. So it is blocked hypofluorescence. It is blocked hypofluorescence. That is the reason why fovea is hypofluorescence on angiography, because of foveal avascular zone, xanthophyll pigments and melanin pigments. So this is, my dear friends, your normal angiography. Okay? I'll show you a video. And tell you how this normal angiography works. When you put a dye goes to heart. From heart it goes into, first it should go into choroid vessels or retina vessels. First it goes into choroid vessels. And then it comes into retina vessels. I tell you, arm retina time is 11 seconds. वो याद रखना है. But first choroid vessels are filled and then retina vessels. See retina vessels are filling now. What will fill first? Artery or vein? What is this? Artery or vein? Of course artery will fill first. And slowly it will go into the vein. Slowly, see, now its vein is filling. See, vein caliber is more, 2:3, vein is more, vein is filling, and it will go out of the retina. It will recirculate many times, then it will go out of the retina in 10 minutes time. In 10 minutes everywhere, the dye will go out of the retina. So this is multiple photographs we take at various levels. Again, I'll show you the video. See again, we put the injection in the vein, heart, choroidal. See, choroidal first. See, there is choroidal first. If you can appreciate, choroidal flush. And then it comes to the retinal artery. Then it goes into the vein. And then out of the eye. 10 minutes it goes out of the eye, out of the eye, out of the eye. Why first in choroid? Very good, Garima Bansal, because from the ophthalmic artery, the choroidal vessels have the route from the dye. The choroidal vessels are first, and then comes the central artery. The pathway, anatomy, the pathway from the ophthalmic artery is like that. That the first there will be dye, the blood goes into the choroidal vessels. That's why dye will also go into choroidal vessels first, and then central artery. Arm retinal time 11 seconds. So 10 seconds you can take it as it goes into choroid. 1 second before it goes into choroid. And see here, this is dark. Why dark? 3 reasons I've told you. So I have explained you normal fluorescein angiography, my dear students. अब क्या पढ़ेंगे? अब पढ़ेंगे clinical applications. Let us see now quickly some clinical applications. Okay. Now this requires a knowledge of some retina also, but I will try to make it simple. It requires some clinical knowledge of retina pathologies. But I'll tell you 5 clinical applications quickly. फिर कुछ एक दो questions भी I'll tell you. First, what is this investigation? OCT. Any abnormality can you see? This is the same picture I showed you. This is normal optical coherence tomography, correct? Now my first question is, what will happen if the outer barrier is broken down? What is outer barrier made up of? RP. This RP here in the central retina is broken down. What will happen? Sir, outer barrier break is preventing the choroid blood to go into the retina. If outer barrier is broken down, choroidal fluid will come into the retina. Yes. If outer barrier is broken down, choroidal fluid will come into the retina. Between the neurosensory layer of the retina and the retinal pigment epithelium, there will be fluid. क्या है ये? The 9 layers are separated from the 10th layer because of fluid from the choroid. इसी को तो कहते हैं exudative retinal detachment. Because of break in the outer blood retinal barrier break, choroidal fluid will come into the between the layers of the retina. So there is fluid here. Outer barrier break. What will happen if you do a angiography thing in this? So if you do angiography, the dye will go into retina vessels and choroid. But sir, there is a break over here. The dye from the choroid vessels will also come in the retina space. So where will you see the dye? Central retina, outer retina. Central retina. There is a break in the central retina. इसी को तो हम कहते हैं central serous retinopathy. Serous fluid is coming from the central retina because of outer barrier break. And on angiography, see, in the central retina there will be hyperfluorescence and the dye will rise like a smoke. Pattern को क्या बोला? Ink blot appearance. Ink blot appearance. Yes, very good everyone. Dr Sharma, that is the anatomy of your, if you see the anatomy of your blood supply, the choroidal vessels are first from the ophthalmic artery. Blood goes first in the choroidal artery, then it goes in central artery because the central artery is closer to the eyeball. Okay, so dye will also go first in the choroid. Alright, yes, very good, Sandra. Everyone good. This central serous retinopathy. On angiography, what will happen? There is a central hyperfluorescence. Hyper, dye is rising up. And central, there is dye because of the outer barrier break. What is the clinical question here? You remember? Clinical question. Mostly CS are seen in young males. देखो, young male. Who is in type A personality or under stress. So maybe he's an intern or maybe married also. No. Not all young males are married and not all young married males are in stress. Only 99% are. Okay. Or he's taking steroids. So that is predisposing factors for central serous retinopathy. And if there is a problem in the central retina, how will the patient present to you? The young male with these predisposing factors will come to you with, he will say, sir, distorted images are seen. उसे कहते हैं metamorphosia. He will come to you with metamorphosia. You do OCT, you do angiography, you will see this pattern. This is central serous retinopathy. Where is the break? Outer barrier break. Outer barrier break. Very important. So I have given you one clinical application, central serous retinopathy. Let us see second clinical application. Second application. Inner barrier break. Inner barrier, due to the blood vessels inside the retina, inner 6 layers, central retinal artery, blood vessel, endothelium from the inner barrier. If there is a break of inner barrier, how can there be break? There can be many conditions. Many conditions which can cause inner barrier break. DR means diabetic retinopathy, CRVO, central retinal, branch retinal vein occlusion, inflammation like uveitis, many drugs came in last NEET exam. So many conditions are causing inner barrier break. My question, when there is an inner barrier break, what will happen? If the retina vessels are leaking, the fluid will come out of the retina vessels. Exudates will come out of the retina vessels. They will go intraretinal or outside the retina? Intra, inside the retina vessels there. Inside the retina layer are there. And which layer they will go? They mostly go into the deep layer. Deep layer is what? Outer plexiform. What is the other name of outer plexiform? I told you Henle's. Someone asked, sir, what is the orientation? Radial orientation. So when retina vessels are leaking, fluid is coming, what will happen to the thickness of the retina? Retina will develop cystic spaces like this. See, the thickness of the retina is increased. There is cystic spaces. See this black thing, this cystic spaces. तभी तो नाम दे दिया macular edema. Mostly they go into the macular area. Thickness of the retina, thickness of the macula is increased. Cystic spaces are there. Cystoid macular edema. Seen in all these conditions. And what is the pathogenesis? Inner barrier break. Inner barrier break. Dr. Priya, good evening. This is a demonstration. Not a, very good, Arihant. Thanks. Now what will happen if you do angiography here? When you put angiography, there is a break in the inner barrier. Dye will also come out, na? So dye will also come into the outer plexiform layer. And what is the orientation of the Henle's layer? I told you, radial configuration. So dye will also in the macula go radially like this. Right retina, left retina. So left retina, foveus on the left side. And see, the dye is this white hyperfluorescence. Dye is, because of Henle's layer, is going radially. Naam kya diya? Flower petal appearance. Cystoid macular edema, flower petal appearance, seen in all these conditions, which is written over here. Why can't you see the dye in the vessels? Because it is seen in very late stages of angiography. Very late stages of angiography, the dye remains into the outer plexiform. It goes radially because of radial configuration of Henle's, like a petal of a flower, flower petal appearance. So that is the second clinical application of angiography. Third, very important, inner barrier break, I told you, can be seen in diabetic retinopathy also. So again, if the inner barrier is broken down, the dye will come out. In diabetic retinopathy, in very early stages of diabetic retinopathy, what happens is, you can see these dots, hyperfluorescent dots. These are known as microaneurysms. Very early stages of diabetic retinopathy, mild non-proliferative diabetic retinopathy. Very early stages, dot seen everywhere in the retina. These are microaneurysms. That is another clinical application. Early stages of diabetic, mild NPDR. Now, there is no time for the pathogenesis of diabetic retinopathy, but now tell me, if in diabetic retinopathy what happens? The vessel is leaking. If the vessel is leaking now, later on what happens? The vessel becomes blocked. If the vessel becomes blocked, what happens to the retina which is supplied by the vessels, by the capillary? It will not have any blood supply. It becomes ischemic. There is ischemia of the retina. So if there is ischemia of the retina, ischemia will be hyperfluorescence or hypofluorescence. There is no blood supply to the retina. So that ischemic retina will be hypofluorescence. No blood. No dye. And whenever the retina is ischemic, remember this point. Whenever the retina is ischemic retina produces VEGF. Ischemic retina produces VEGF, vascular endothelium growth factor. Split the words. It grows the vascular endothelium. And vascular endothelium growth factors is responsible for formation of new vessels. New vessels are formed, and new vessels, they leak blood, and they are present above the retina. Above the retina layers, the new vessels are present. So they leak blood. If they leak blood, they are abnormal vessels. They leak blood. They leak the dye. They will leak the dye as well. The new vessels are leaking the dye as well. And if they are leaking the dye, they will be hyperfluorescence. So ischemic retina is hypo. I'll show you a picture. It forms new vessels which will be hyperfluorescence, like you see in this picture. This is the same picture which was asked in AIIMS exam. Can you tell me which retina is this? Right or left? Right, because the fovea is on the right side. What are these yellow areas marked? This is angiography. Yellow areas are hypo or hyper? Yellow areas. Hypo, dark. These are ischemic. These are ischemic retina. And what does ischemic retina produces? I told you. It produces VEGF. And VEGF produces new vessels. And new vessels, what are these black arrows? These new vessels are leaking the dye. They are hyperfluorescence. So what is this picture? This is an advanced proliferative diabetic retinopathy. Ischemic retina produces VEGF. VEGF produces new vessels which leak the dye because it is above the retina. It leaks the blood, leaks the dye, and that is proliferative diabetic retinopathy. Okay, now if there is a lot of blood leaking from the new vessels, if there is a lot of blood leaking from new vessels, where will it is above the retina, I told you. The blood can go into the vitreous. There can be vitreous hemorrhage. So if there is a vitreous hemorrhage, that is also proliferative diabetic retinopathy. Like this, if there is a blood in the vitreous, this is vitreous hemorrhage. Vitreous is pre-retinal or subretinal? Pre-retinal, sir, before the retina. So if there is so much blood, can you see the retina? Retina dikhega kya? Can you see the retina here? No. If you cannot see the retina, vitreous hemorrhage is also hypofluorescence. It is blocking everything behind. It is blocking retina, it is blocking the new vessels, it is blocking everything. So it has to be hypofluorescence. So new vessels, ischemic retina hypo, new vessels hyperfluorescence, vitreous and pre-retinal hemorrhage hypofluorescence. It is blocking everything. Vitreous hemorrhage is blocking everything in the retina and new vessels. So hypofluorescence, that also comes in proliferative diabetic retinopathy. Alright, that is the fourth scenario. Quickly, the last scenario. Age-related macula. So this is a slightly difficult as compared to, now the topic is not difficult. The fluorescence angiography, very rarely this picture will be asked, but I will tell you. What happens when old age, old age, there is some problem in the macula. What is the problem in the macula? See this. Is there rods and cones, then RP layer, then Brooks membrane, choroid. What happens when we age? The end products, lipofuscin end products, they usually go from the choroid into the retina and they go out of the eye. But with age, what happens? They accumulate in the RP layer. That accumulation is known as drusen's, which you can see is deposited in the macular area, yellow deposits in the macular area. तभी तो नाम दिया age-related macular degeneration. What is deposited? Drusen's are deposited in the mostly RP layer, retinal pigment epithelium layer, under the RP layer in the Brooks membrane. In the Brooks membrane, RP Brooks membrane, they are deposited. Drusen's are deposited. When there are only drusen's, it is known as dry RMD. When new vessels come from choroidal new vessels, that is wet RMD. I will not go into detail. What I am going to show you here is the drusen's, they are seen on angiography. They will also stain. Late staining will be seen like this. Again, white. So they are also hyperfluorescence due to dye is not leaking here, due to staining. Due to staining, they retain the dye, so they are also in the macular area hyperfluorescence. So how is the question come to you? Clinical scenario, old patient come to you. Old patient. There is a problem in the macula. Distorted images, metamorphosia. Old patient come to you with vision loss, with metamorphosia, with drusen's. It is age-related macular degeneration. This fluorescence angiography picture usually won't be asked in your exam, but just for completion I'm telling you, this will also be hyperfluorescence. Drusen's will be hyperfluorescence due to staining. So these are दीप्ति हर चीज को जनरलाइज नहीं कर सकते, ठीक है. These are the 5 important scenarios for a fluorescence angiography. Let me now ask you one more question. Let me take you one level ahead. 5-10 minutes more I'll take. Can you tell me which eye is this and what is happening here? So eye we can tell very quickly, sir, because this is the right fovea on the right side, this is the right eye. Sir, what is happening? Sir, some problems. So vessels, they are not having dye. What is going on? So this is not fluorescent angiography, sir. In fluorescent angiography, the vessels have hyperfluorescence. There is dye in the vessels. Here there is no dye. Because students, dear student, this is not a fluorescent angiography. This is autofluorescence. I remember what was the property of angiography? Fluorescence. Low wavelength come inside, high wavelength goes outside. There are some deposits. In the retina. One I have told you today, drusense, and one more is lipofuscin. They themselves have a property of fluorescence. Auto, खुद से उनको property है fluorescence की, in which if you throw them a low wavelength light, any low wavelength light, they will emit a high wavelength light. So in those depositions, when these two are deposited in the retina, you don't need a dye. They themselves emit a higher wavelength when a low wavelength is given to them. This is autofluorescence. So how will you differentiate a fluorescent angiography from autofluorescence? Look at the vessels. Vessels, if there is dye, it is angiography. If the vessels is dark, it is autofluorescence. Some examples quickly I'll tell you for autofluorescence. A little advanced level. देखो ये drusense, which I was mentioning in age-related macular degeneration. See, everyone can appreciate it is autofluorescence. Vessels is dark. Both is autofluorescence. These are drusense. Small, white. In age-related macular degeneration. This is also drusense of the optic disc. Optic disc drusense. There are some calcific deposits, the myeloid deposits. That can also be seen on autofluorescence. So drusense can be seen, lipofuscin can also be seen. Drusense, one in optic disc drusense, one in age-related macular degeneration, जो मैंने आपको बताया है. Other, what was the deposition? Lipofuscin. Now lipofuscin का भी एक example दे देता हूँ आपको. Stargardt's. It is a dystrophy of the retina. I'm not going to detail. See which one is a angiography, which one is a fluorescence, autofluorescence. See this picture. This is the right retina. This is angiography. Now you can appreciate this. Why? The vessels have dye. This is autofluorescence. Why? See the vessels. Vessels are dark. And see this. These are lipofuscin deposits. White are retina flecks. These are lipofuscin deposits, which I have told you already. They are deposited in Stargardt's dystrophy, and this lipofuscin is deposited all over the retina. So angiography में क्या होगा? Jipmer question last time. If it is deposited all over the retina, the choroidal vessels are not seen; they are blocked. So that is why you get a dark choroid on angiography. Lipofuscin is deposited all over the retina. So choroidal vessels will not be seen. There is dark choroid on angiography. But on autofluorescence, there will be hyperfluorescence because they have a property of emitting a higher wavelength light. Okay, so these are some points which you want to know for autofluorescence also. I've just told you one extra. From angiography, I've taken to autofluorescence. And how to differentiate? Vessels have dye, angiography, vessels don't have dye, autofluorescence. Just remember 2 points for autofluorescence. Drusense, lipofuscin, 2 are depositions which have property of autofluorescence. Okay? Alright. Now I'll ask you 2-3 questions quickly and then we'll wrap it up. Can now someone of you can answer this question quickly? The dark appearance of fovea. Yes, it is dark appearance of fovea. It is caused by all of the factors except. What can be the answer? Piyush Kumar, in autofluorescence, the whitest retina flex, that is lipofusion deposition. In angiography, the background is white, dark because it is blocking the dye. Can someone answer this question now? A, B, C, D. There are 2-3 questions. Let us see what have you understood. I know there is a 30 seconds lag, so I am just waiting for some answers. Is there absence of blood vessels in the foveal avascular zone, blockage of fluorescence of choroid due to xanthophyll and melanin, less number of layers of the fovea? So A, very good answers. A is the correct option. B is also correct option. D is also correct because of the high melanin content and xanthophyll at the fovea. Yes, there is less number of retinal layers at the fovea, but that is not the reason for dark appearance. So C is a wrong statement and a correct answer to the question. Very good, everyone. Very good. Yes, everyone is correct. This is the correct answer. Excellent. No, Annette, I told you now, there is xanthophyll and melanin more in the fovea. That's why it is blocking the choroidal dye. Yes, very good. Ashwini, Santan, everyone, very good. Now, can you answer this question? Image-based question. I have marked the area in the retina. First, tell me this is right retina, left retina. ये तो सबको पता है. Right retina है ये. There is right retina. No issues in that. The area marked. What is true for the area marked? Except. Very good, Saurabh. Very good, Saida. Very good. Some people are answering. Yeah, they are getting actually a feed before. So good answers. Is it hypofluorescence area? Yes, hypo. It is dark now, so it is correct. And what is this? This is the ischemic retina. It is ischemic retina. It is not a pre-retinal hemorrhage. It is producing VEGF. And yes, it can be seen in diabetic retinopathy. So D is answer. Piyush, नहीं गलत कर रहे हो. Hypo है ना, dark area है. Dark is hypo. This white area is hyper. That is due to VEGF and new vessels. Yes, Indrani. Excellent. Can someone answer this question now? Very good. Which statement is false for this condition? What is this condition? Which eye is this? And what is the condition? This is spot diagnosis now. This is optic disc. This is the fovea. Right or left? So left angiography, sir. What is this? Some pattern I told you today. Some pattern. कुछ तो pattern है. What is the pattern? So radial configuration. Yes, sir. Yes. This is cystoid macular edema. We have to answer according to cystoid macular edema. Flower petal appearance. Is there a thickening of the macular area? Yes, there is thickening of the macular area. Macular edema. नाम से English भी अच्छी है हमारी बचपन से अच्छी. Is there a break of outer or the inner barrier? Inner barrier, sir. Inner barrier. Outer barrier तो central serous retinopathy में होता है. And what is the radial configuration due to Henle's layer? And I told you, it is more prominent in late stages. तभी तो vessels made. You can see the dye is almost over. You see, dye is already leaving the eye almost. So late stages it is seen. More prominent in the late stages. So it is a break of the inner barrier. So B is the answer of this question. Very good, everyone. Very good, Sumit. Sumit, अच्छा Sumit ने एक ही बारी आंसर करा है. Thank you, Sumit, for that. Yes. Very good. Okay, and now this is the end of my demonstration. Sorry, 10 minutes more I took. So this is for those people who don't know about the Live Course Immerse app. So there is an app. All the features of a regular course will be there. All 19 subjects will be there. Mostly it will be covered in about 7 months. And those people who are getting first 1,000, so they will get this hard copy as well of the next generation ophthalmology. Also, I have done it myself. I know it will be very useful for you. And see, there is a circular course, means anytime you can join it. You can join it anytime, and it is sort of rotatory. So if you are joining late, you will get again, not that you can see recorded also, but you can join the other batch for the live. So it is a rotatory circular course. And of course, this is my referral code, which you can see here down as well. But I don't call it as a referral code. I call it as a mentor code. Okay, I will be your personal mentor. Okay, who is a mentor-mentee? It's a mentor-mentee concession for you. And you want, if you are stuck, you want there and then you want your answer, I will be always available, as I'm available on every platform, the club. I try to answer as soon as possible. So here also I'll try to answer as soon as possible. If you, subscribe with this my code. So I don't call it as a referral code, please. I don't like this word. I like mentor code. So please, those people who want to study with me as a mentor, I have my mentors. I regard them. I am graceful to accept everyone. You can be my mentee. I'll be very, very happy. I'll be very happy to take you, and I'll be very happy if you do well in your exams. You can follow me on देखो ट्विटर पे भी हूँ मैं, आ गया फेसबुक क्लब एंड पेज, और इंस्टाग्राम पे भी अभी लर्निंग लिटिल बिट. एंड सी कोड भी मेरा इन्होंने, आई होप 440 नहीं लिखा, 540 ओके. सो ऑल द बेस्ट एवरीवन. Thank you for listening for the demo lecture. I hope you understood some points regarding angiography. All right, and thank you very much. All right. Okay, some questions here. Why autofluorescence? There is no vessels in the dye, because it is auto. We don't put any dye. That's why the vessels do not have any dye. Yeah, Yukti, of course I will take lecture na. Of course I will take lecture in this course. Of course. Why not? Mega, I don't know about that. Please ask the head office for that. सौरभ कुमार, नाम बड़ा अच्छा तुम्हारा, क्वेश्चन तुम्हारा अच्छा क्यों नहीं है? क्या पूछ रहे हो? न्यू वीडियो, ओल्ड वीडियो, समझ नहीं आया तुम्हारा क्वेश्चन. मैसेज करो मुझे. ऑलराइट, थैंक यू एवरीवन. ठीक है, बेस्ट ऑफ लक. ऑलराइट.